How is lip enhancement done for people over 50?
Having overfilled lips seems to be a popular procedure among some younger people, particularly on social media, which often makes people of all ages concerned about being overdone if they were to have a procedure. Specifically for people who are in their 50s and older, lip enhancement is not just about adding volume to the lips. There are also some changes that affect the area around the mouth for many people who are over 50. In addition to volume loss or deflation of the lips associated with normal aging, there is oftentimes loss of lip border definition and downturning of the corners of the mouth. Very often there are lines forming above and around the mouth. I'll discuss how I approach lip enhancement for people over 50 and how these procedures can be done safely and quickly so you can look your best at any age. As I mentioned before, people over 50 often notice changes in their lips, such as the loss of volume or fullness of their lips. This is consistent with one of the first signs of aging, which is generalized facial volume loss. It therefore makes sense that the fat and soft tissue in the lips would diminish with normal aging. As aging progresses, volume loss in the lips may be more pronounced, with the lips progressively thinning to the point that the red or pink part of the lips can become barely discernible. Volume can be restored to the lips to make them look fuller and more well-defined. This occasionally sparks a fear in some people who've seen people whose lips are overinflated with filler to the point of looking extremely unnatural. So my approach to lip enhancement is focused on restoration of volume, so my patients appear to look closer to a younger version of themselves. For many people over 50, the loss of volume in their lips also results in a loss of the natural shape of their lips. The way I approach this problem is to gently and precisely restore lip volume and shape using a hyaluronic acid filler, such as Restylane, for example. I place the hyaluronic acid filler into the lips with a special instrument called a cannula. I prefer using a cannula since the cannula is blunt and not sharp like a needle. I find there is less likelihood of bruising and excess swelling in comparison to the use of a needle. I also find that I'm able to place the filler more precisely in specific areas because there is less bruising and swelling, which can of course obscure the fine detail of the lip anatomy that I want to treat. Conventionally, when filler is placed, the injector has to use a needle to inject multiple areas in the lips. In contrast, I'm able to minimize the number of entry points when I use a cannula, which makes the experience much more comfortable for my patients. As a facial cosmetic surgeon with several decades of experience, I'm intuitively aware of facial balance and proportionality. Proportionality in nature is often revealed to follow a mathematical relationship called the golden ratio. The golden ratio is a ratio of 1 to 1.6, which for many people is a ratio of 1/3 to 2/3 between the upper and lower lip. This volume relationship is generally perceived to be more youthful. In addition to the loss of lip volume and definition, the muscles around the mouth are oftentimes also affected, resulting in the mouth having a downturned, frown-like appearance. In order to improve this frown appearance, I often use a neurotoxin such as Botox, Jeuveau, or Dysport to relax muscles which pull the corners of the mouth downward. This allows the muscles which lift the corners of the mouth to work unopposed, letting the corners of the mouth move in a more upward direction. This procedure is known as the Botox lip lift and can give a warmer, more welcoming facial expression when the mouth is at rest. Since no one looks at your lips in isolation, we also focus on areas surrounding the mouth and refer to this as perioral rejuvenation. For example, the area above the upper lip may have vertical lines which become more pronounced when engaged in an activity like drinking from a straw. These vertical lines can also be improved with a neurotoxin such as Botox or Jeuveau to decrease muscle movement, thereby improving the depth of these lines when the muscles are engaged and even when the muscles are at rest. Hyaluronic acid fillers can also be placed to reduce the depth of these lines. PRP or platelet-rich plasma or PRFM and skin boosting can also be performed to stimulate collagen production and to improve skin quality. Laser treatment can be used to stimulate collagen with no downtime. Lasers can also be used to resurface the skin to address finer lines and wrinkles with about a week of downtime. Facial volume loss can also create deep lines at the lower corners of the mouth called the mesolabial folds or marionette lines, as well as the sides of the mouth, which are called the nasolabial folds, otherwise known as parentheses lines. Volume restoration using an injectable hyaluronic acid filler for these lines can make them appear less pronounced and contribute to a better overall appearance around the mouth. The chin is a very important part of the perioral area. Age-related volume loss also results in significant decrease in bone volume, resulting in a somewhat receding chin. Although facial implants, such as a chin implant, can be very effective, the majority of my patients enjoy the benefits of getting comparable results using long-lasting hyaluronic acid fillers. So how is this possible? It's possible with an advanced filler placement technique called structural volumizing. Unlike conventional filler placement, which is limited to the soft tissue, structural volumizing technique enables me to place the filler at the bone level in a way comparable to the placement of a facial implant. The result is a well-defined and balanced-looking chin without surgery. People often are bothered by the appearance of chin dimpling, describing the area as looking like cobblestones or like an orange peel. Chin dimpling is due to bone loss and overactivity of a muscle called the mentalis muscle. We reduce the activity of this muscle in the chin with a neurotoxin like Botox, Jeuveau, or Dysport and help the skin look much smoother. Perioral rejuvenation is very popular, and I routinely perform these procedures in my exam rooms with minimal to no downtime. Our patients often have these procedures done during their lunch hour and return to work right afterwards. As with all my patients for injectable treatments, I see my patients after 2 weeks and to see how everything looks. At that time, we make any adjustments as needed. I hope you found this information from my experience helpful. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to arrange a consultation. Thank you.